Benign prostatic hyperplasia, or BPH, is a non-cancerous enlargement of the prostate that occurs as men age. Studies show that 40% of men in their 50s have BPH, as do 80% of men in their 70s. Well, now there's a breakthrough outpatient procedure that can help, and here to tell us about it is Dr. Lance Walsh with Walsh Urology Associates. Welcome, doctor. Thanks for being on the show.
Thank you for having me.
Yeah, so what exactly is BPH? Or an enlarged prostate? Can you explain that?
BPH is an enlargement of the prostate such that it obstructs the urethra. The bladder is an organ that fills and empties, and it empties via a tube called the urethra. And the prostate sits around the urethra, and it actually can work in some people like a vice to close off the urethra as it gets bigger.
So this can affect urination, I'm guessing.
Absolutely.
And probably is somewhat uncomfortable, and also probably disturbs your sleep.
Absolutely. Right. It can cause sleep problems, and it can cause problems with having to go frequently during the day, difficulty with urination, all of the above.
Okay. What are the different treatment options?
So BPH, there are first behavioral options. So if you're having to urinate frequently after drinking that cup of coffee in the morning, you may want to hold off on that. Or alcohol and caffeine can cause problems. There's also medications as well. Medications like Flomax or Avodart, Proscar, those can help, but they can have side effects of dizziness. There can be sexual side effects, and really they're only minimally effective. You know, traditionally there's been a surgical option, either a TURP or a holmium laser enucleation of the prostate, which is really maximally effective, but it can also have significant sexual side effects like no ejaculation with orgasm, also risk of bleeding and risk of incontinence. And so the newer treatment on the block, and I say new, it's been FDA approved since 2013, is the Eurolift. Okay,
tell us about that.
The Eurolift is a procedure that's done in the office, typically, with a local anesthetic.
So like an outpatient?
Absolutely.
Right?
Well, even in the doctor's office.
Oh, wow. Okay.
Under a local anesthetic, and can be done in a period of about certainly less than an hour. And
wow.
Generally, people are back to normal activities within a week. It's been the only treatment for BPH that's been studied that has not shown to have sexual side effects that you see with surgery or with medications. And it is more effective than the medication, not quite as effective as the surgery, but it should be considered for people that want to, maximize their sexual function and improve their urination.
Okay, and we were just looking at a video there. It's that simple?
Yeah, I mean, you know, the prostate lobes are very spongy, and the engineers that designed it took that into account. And the way the technique is performed is the rigid scope is put in through the urethra. It's used to compress the lobe of the prostate, and then a suture with 2 anchors are fired to hold it in the compressed state. And then a series of those are placed in order to create the desired channel through the prostate.
Okay, and finally, I've got to ask you, what does it mean to be a Eurolift Center of Excellence?
We were the second Eurolift Center of Excellence in the country, and essentially it means that we have the quality outcomes, the experience. I've treated over 500 patients and have published my data. You know, we're considered experts in the area. I've trained other urologists, not only nationally, but internationally as well.
Okay, well, that's exactly who we want to go to as an expert. You can contact Walsh Urology Associates by calling the number right there on your screen. They have 2 locations, one in Rancho Mirage and one in Palm Desert. Log on to their website at walshurology.com. And many thanks to Dr. Walsh for joining us on today's show. Thank you, sir.
Hey, thank you.
All right, we will be right back.